Hello and welcome to World Health Plus Social Good. We're coming to you live from the World Health Assembly here in Geneva, Switzerland. I'm Vismita Gupta-Smith from the World Health Organization's headquarters. And for the next 3 days, we're going to bring you live discussions with public health experts talking about issues that are on the agenda here at the Assembly. Also, don't forget that you can ask your questions. Just hashtag it, WHA69 and WHA Social Good. Today we're going to talk about one of the most talked and discussed public health issues here, also a big public health threat. It's been described a threat at par with climate change and terrorism by some. It's called antimicrobial resistance, a complicated name for a complicated situation. And last year at the World Health Assembly, governments came together to endorse the Global Action Plan to tackle antimicrobial resistance. Here to talk to us about the issue and about the Global Action Plan is WHO Director General's Special Representative on Antimicrobial Resistance, Dr. Keiji Fukuda. Welcome, Dr. Fukuda.
Thank you.
It's a difficult concept to wrap one's brains around, so could you please decode it for us?
Sure. I think the word is a little bit intimidating, but I think the basic situation is something that everybody can understand. Right now, what we're seeing is a major threat developing around the world to families, to communities, to countries. The scientific issue is that we are now seeing a broad range of infections become resistant to the medicines that we use, basically become untreatable. These are not esoteric infections. We're talking about urine infections, blood infections, pneumonia, sexually transmitted diseases, HIV, TB, malaria, a broad range of infections. What this means for people is that there are now more and more people getting infected with things which can't be treated. And consequently, some people have to stay in hospitals longer, and many people are going to die. So more people are dying now. So this means that we are beginning to see around the world an increase in people staying sick longer. There are some really important implications out of them. One of them is that we rely on these medicines, antibiotics, to be able to do things like surgery safely. People get heart operations, get hip replacements. When women undergo childbirth, we depend on having antibiotics available to give them a safety net. When people develop chronic diseases like diabetes, they're more prone to getting infections. We use them to protect these people with HIV. So this is one big impact, and it may change how we have to think about medicine. This is going to cost a lot of money. If people are in hospitals longer, it just takes more to treat them. It takes more to use second-line drugs, third-line drugs. But also, once you begin to see children die, young people die, this means that the productivity in countries can be expected to go down. To put this in some kind of round numbers, it's been estimated by the year 2050, we may see more people die from these kinds of infections than from cancer. If we look at one country right now, they are having 23,000 people die each year and spending $55 billion per year. It gives you a kind of sense of the amounts of money.
That's a scary situation. What needs to happen to preserve these antibiotics?
Well, I think to put this in context, if we look at why are we in this situation, we're overusing these medicines, misusing them in both health and in agriculture. In many countries, we don't have the right systems, for example, surveillance or regulation to deal with the issue. And also, we're not making enough new medicines to keep up with the problem. So I think that what this means is that what we need to do is increase the awareness of people around the world. Right now, many people are just confused about it. There is a blueprint about what to do, the Global Action Plan, and we need to put it into action. And then finally, we need to get the political engagement and the financing to implement these plans.
Tell us more about the Global Action Plan. How does it address this huge issue?
Well, the Global Action Plan was adopted by the Health Assembly 1 year ago here. And what it represents is the consensus scientific opinion of the best minds around the world but it also represents the consensus of multiple sectors. So we had experts from agriculture, as well as from health, as well as from other sectors come together and say, what does the world need to do? And that's the blueprint. It basically lays out all of the activities we need to do to curb this issue.
And that sounds like an ambitious plan which is going to trickle down to countries who will also have their own national plans to tackle antimicrobial resistance. We'll talk a little more about that later, but let me take some questions from our viewers. I'm going to go to Pinky Patel from UN Foundation. Pinky, do you have questions for us?
Thanks, Susmita. Yes, we do. Our viewers would actually love to hear the personal opinion about what worries you most in addressing antimicrobial resistance, and alternatively, what gives you the most hope?
Dr. Fukuda?
This is a really good question. What gives me the most hope is that when we lay out the issues, there is nobody who says this is a small problem. The scope of everybody being at risk, families, relatives, everyone that you love actually being endangered by this issue quickly brings everybody around the table. What scares me the most is that because it's a complicated issue, we have to make sure that we deal with each of the complexities, but not lose sight of the big picture, not lose sight of the fact that this is basically something which is harming people, and not to get sidetracked with issues that may detract from that attention.
Dr. Fukuda, you touched upon the use of antibiotics in livestock. How does that impact human health, and how does that contribute to the problem?
Sure. I think agriculture, like human health, is caught in a kind of a bind. On the one hand, agriculture depends on having effective antibiotics to treat sick animals. Animals get sick, and we also depend on that ability to have a sustainable food supply. So we need effective antibiotics. On the other hand, a huge amount of antibiotics are used by agriculture. In some countries, up to 2/3 of antibiotics are used by agriculture. Some of these are for treating sick animals, but some of them are for non-health purposes, basically as growth promoters. And we feel that this is helping to fuel the development of AMR.
Dr. Fukuda, very quickly, tell us what you expect to come out of the high-level meeting on AMR in September at the UN General Assembly.
Sure. Well, as I mentioned, we have the blueprint for what to do. We know what to do. What we really now need are the heads of states to come together and say, we see that there's a big problem. We see that there is a solution for this, and we are going to give our political engagement. We are going to provide the commitment and the financing to make sure that the plan can be implemented. And that's really what we hope to have come out of the high-level meeting in September.
Thank you very much, Dr. Fukuda, for taking the time and decoding antimicrobial resistance for us. So that sets us up nicely for the rest of the show. Actually, we are going to now go to a recording of Ms. Daphne Dekkers, television host, a model from Netherlands, who was speaking on the sidelines of a ministerial conference on AMR. Let's hear what Ms. Dekkers has to say.
I became ill, and the doctor thought I had a bladder infection, and he gave me antibiotics, but it never really went away, and they thought I had multiple bladder infections. But after months and months and months, it became clear that my bacteria was multi-drug resistant, and to treat this type of E. coli bacteria that I have, or had, I hope, there are 8 different types of antibiotics available, and 7 of those do not work anymore. So I'm on number 8 now, and this works so far, but it makes you also a little bit nervous, because you start wondering what happens if my bacteria learns to defend itself against antibiotic number 8 as well. You know, what are we going to do then? And then I started researching it, and then I found out.
That is a scary situation, one that is becoming all too common, unfortunately. Now, the UK government commissioned a review of antimicrobial resistance, and the report of that review came out last week. Here to discuss the report and the review with us is the head of the review committee, Hala Audi. Welcome, Hala.
Thank you for having me.
Sure. It seems that the review's findings also focused on the economic impact of inaction on antimicrobial resistance. What does it cost the world to not act on AMR?
That's right. We worked with two teams of economists under the leadership of our chair, who's macroeconomist Jim O'Neill, to model what it would mean for the world if you let drug-resistant infections rise, such as malaria or resistant tuberculosis or rise in resistance in HIV or E. coli or pneumonia. So we modeled 9 of these diseases and found that by 2050 you could lose as much as $100 trillion of accumulated output. That means between now and 2050, you would lose the equivalent of 1.5 the size of the economy in lost output because more people had lost their lives to these drug-resistant infections and weren't working. So, of course, it's the human cost that matters most, 10 million lives by 2050. But that adds up to an enormous economic cost that policymakers need to take into consideration and act now.
10 million lives by 2050. That is a staggering cost. Tell us some more about your key findings.
So first, I want to say that antimicrobial resistance is a problem today. And if you worry about 10 million lives in 2050, we should also all worry about 700,000 people dying today every year from drug-resistant infections. And that's 200,000 from TB alone, resistant TB alone. At the heart of our findings is a market failure and a policy failure that leads to the rise of drug-resistant infections. And that's because, on the one hand, you have a lot of people suffering in their health or dying from lack of access to antibiotics, while at the same time there's a lot of excessive use of antibiotics in other sectors. So we overuse antibiotics in humans. One staggering figure is in respiratory issues. When we go see the doctor for something respiratory with symptoms, there's academic estimates that 2/3 of people are getting antibiotics unnecessarily. There's also a lot of waste in agriculture where we're giving antibiotics for no good reason because it might be leading to growth promotion or instead of having better farming practices, and that's not a good place to be when those drugs are losing effectiveness.
Hala, I want to talk more about the recommendations from the review, but first I want to take some questions from our viewers. Pinky?
Yes, Vismita, a lot of our viewers are asking, is there an ideal way to dispose of antibiotics to prevent antibiotic resistance?
That's a very good question, and unfortunately there isn't one answer. But the most important thing when you dispose of antibiotics, what you want to have in mind is you don't want the antibiotic, the active ingredient, to meet bacteria, because it's when bacteria meet drugs and antibiotics that they get used to the antibiotic and they develop this resistance. And so that's the most important thing about disposal, whether it's at home or in a hospital. You have to do it in a way where the active ingredient isn't going to meet the bacteria, which is very often in wastewater because of where these places are. But it's also really important in manufacturing plants where we produce pharmaceutical ingredients and antibiotics are let to go into the rivers near the plants without being treated. They can often meet the sewage system of the next city near that manufacturing plant, and that leads to a lot of bugs meeting a lot of drugs and therefore resistance. That's a really scary thought that needs to be tackled urgently.
That is a fascinating and scary scenario, a lot of bugs meeting a lot of drugs. I'm going to quickly ask you about your recommendations to tackle this very scary situation.
So we have a 10-point action plan, and I won't go through it, but to name just 3 of them. There's one on the demand side. We need to use our antibiotics better, and to do that, we need to modernize the way we prescribe them, and we need to come up with rapid diagnostics that can help inform the judgment whether you you need an antibiotic or not. It is not acceptable that we do it based on your symptoms or my kid's symptoms, the way it was done 50 or 60 years ago, given the advances in technology in so many other places. We also need new drugs. It's not the whole solution, but we do need new drugs. In TB, it's incredibly urgent and important. It is also incredibly important for a number of bacterial infections, and we have very specific proposals on how to do that. And finally, we need better public awareness. I mean, it's incredible how much people know about AMR in the world of health and healthcare, and how little people know about it outside the world of health. And I think we all need to make an effort to convince governments to start what is a truly ambitious public awareness campaign. So this is not some hard to pronounce word that nobody understands what it's about.
Thank you very much for coming and talking to us about this very important review. So clearly, public awareness is a very big part of tackling antimicrobial resistance. In fact, last year, Antibiotics Awareness Week was observed for the first time globally. Let's take a look at a video from that campaign. Simple messages on public awareness, but clearly there remain a lot of challenges on the ground. And here to talk about the challenges that countries are facing in tackling this very complicated issue is Ms. Precious Matsoso, Director General of Department of Health in South Africa. Welcome. And Dr. Poonam Khetrapal Singh, Regional Director for WHO Southeast Asia region. Welcome. I'd like to start with you, Ms. Matsoso. If you could please elaborate on what are the challenges in South Africa and how is the country handling it?
Well, the first is that South Africa is one of the countries that responded promptly to the global plan of action.
May I ask you to hold your mic a little closer?
The global plan of action on antimicrobial resistance. We were quite enthusiastic in that in 2014 we invited all stakeholders to a meeting where they signed a compact, a declaration that everyone is going to respond and play a role in fighting antimicrobial resistance. You probably know the biggest challenge in South Africa is that we've got a triple burden of resistance. Resistance to antiretrovirals, resistance to anti-TB drugs, and resistance to antibiotics. We call it triple burden. Now, with that kind of a burden, with a high burden of disease, obviously you have to bring everybody on board. And one of the things that we did was to sign that commitment when we came up with a strategy, our framework strategy to fight antimicrobial resistance. We have a governance that involves it's a multi-stakeholder governance structures with a drive for stewardship. The nice thing about stewardship is that it's not government driving this. It's an association of doctors and a group of nurses who are driving this, because our view is that if you want to make a difference in hospitals, it must be doctors and nurses who are involved. And we also have jacked up our surveillance systems, so our lab services are also part of that network. And we will not win unless we have education and advocacy, in particular that of patients, by raising their awareness. So we just completed an awareness survey to check whether do South Africans really know what antimicrobial resistance is about. Do they know that it's actually not good to ask for antibiotics when you have flu? do they actually know that they can demand their doctors to wash their hands before they touch them? So we've actually introduced those preventative measures, and we've started work on awareness campaigns in hospital settings, for professionals and also for patients.
I want to come back to South Africa and talk a little more about it. Let me come to you, Dr. Khetrapal Singh. These challenges that Ms. Motsoso is describing are not unique to South Africa. Many countries are facing that. Your region actually is home to a quarter of the world's population and a huge disease burden. What are some of the challenges you're facing, your countries are facing?
Well, countries of this region, the Southeast Asia region, do recognize that AMR is like a ticking time bomb. And the safety net that was created by AMR is now fast eroding, and therefore immediate action is needed. They recognize that. The challenges that we really face in the region are multi-sectoral collaboration, because it's not confined just to the health sector. Other sectors are also involved. So we need to get the animal sector, the agriculture sector, the environment sector involved. And that at times becomes a challenge at country level. And that is something which we are trying to address. The second major challenge is regulation. That is a major challenge there. And there are prescriptive practices which need to be regulated. There is across-the-counter sale of antibiotics which needs to be regulated. These require regulation, and many countries of the region do not have that kind of regulation, though I must say that they are cognizant of it, and some of them are moving on it. So I do think that to address all this, one does need to think of how more research could be done, how innovative approaches could be adopted, and how countries of the region could plan and see how these various sectors could move forward together.
So I'm hearing coordinating across sectors as one of the challenges. I want to take a question from our viewers now. Pinky?
A lot of our viewers are very curious to know, what is the level of public awareness about antimicrobial resistance in the countries of your region?
Let me start with you, Ms. Motsoso.
Well, like I said, we conducted a survey, and the results were released late last year. There is some level of awareness in South Africa about antibiotic use. But I think it's not to the level that we want. The biggest challenge is that South Africans still think that they can demand an antibiotic if they have flu. And that somehow tends to put pressure on doctors. But what I like is that we do have a good regulatory system. We restrict prescription, but that on its own is not enough, because it doesn't stop doctors from using antibiotics when they're put under pressure. But we also have bad practices by doctors, by the manner in which they prescribe. I mean, we got one of the prescription with 17 different antibiotics, for instance, prescribed for one patient. And I actually said, if this patient took all these antibiotics, I don't think that patient is alive. So that tells you that we need something more for doctors, meaning we need to change just that aspect in the manner in which we regulate. The same way as we regulate drugs, we may need to regulate antibiotics the same way.
Clearly awareness and awareness at different levels, at the level of the user, the practitioners, the policymaker. Let me come to you, Dr. Khetrapal Singh. I've got about 30 seconds. If you could talk about the level of awareness.
As far as the ministers of the region go, and we do need high-level political commitment to move forward on this, there is awareness. And it goes back as far as 2011, when the ministers of the region got together and adopted a declaration in Jaipur, which has been guiding our work on AMR in the region. And there was a follow-up meeting which was held in Jaipur in 2014, after 3 years, to see where had we reached with it. Now, to quantify the level of awareness that you mentioned in different segments is very difficult to say, because yes, people, we've never had a survey to quantify it to see that what is the level of awareness. But we do know that there are gaps. For example, there are people who would not know that a regimen of antibiotics has to be taken, say for 7 days for it to be effective. They may just drop it in 3 days when they are feeling they are fine. And there are doctors also who prescribe antibiotics for even something like a common cold, which is not necessary. And therefore, I think this kind of awareness needs to be created more. There would be some who are aware and some who are not. So we need to focus more, which we are trying to do in the region, on raising the general level of awareness of people and also having some kind of capacity building for the medical practitioners, for the vets, for others involved in the sector to see that, yes, all of them do follow the practices which would help us to contain the problem.
Thank you very much, both of you, for taking the time. I know you're very busy at the World Health Assembly, so we do appreciate you joining us here today. So you just heard how countries are actually tackling the problem and attacking it from different angles, multi-sectoral coordination, public awareness, reaching out to different stakeholders, and making them aware of their role in tackling this issue. However, while countries are working to preserve the existing antibiotics, new antibiotics are actually not coming as fast as they should. We urgently need new antibiotics in the pipeline. And here to talk to us about this issue is Dr. Peter Baer, Senior Advisor at WHO. Welcome, Peter. My question to you is this really the end of the road for antibiotics? Is this such a dire situation that we have no other options coming up?
Well, we do hope that we can still turn around the wheel, but it is true that the R&D pipeline is pretty empty. We are not seeing the antibiotics we would need to see coming to the market to replace actually the antibiotics that currently are losing their effectiveness against the bugs.
Now, if this is such an urgent need, why are new antibiotics not being produced?
Well, there's no one answer to it, but there are a number of aspects. First, the easy ones have been developed very early, years ago. So to develop a new class of antibiotics, it's a long-term investment. It will take you a number of years to develop a new drug from scratch to actually until it reaches the bedside of the patient. And it's also a huge financial investment. So if companies that develop new drugs are looking at where they should invest, they might actually decide to invest into research and development efforts in areas where they can make a bigger return on investment. Because antibiotics, it's a crowded market. You have a lot of antibiotics on the market. It's not covering chronic diseases. So the return on investment is not that attractive.
Now, I want to take some questions from our viewers at this point. Pinky?
We have a very interesting question about how to balance access versus excess. How can we make sure that we're providing antibiotics to those who need them while ensuring appropriate usage?
Peter?
Yeah, we are speaking actually a lot about conserving and appropriately using the antibiotics we do have to actually delay resistance building. But it's true, what the question that was raised, we also have to ensure that people who need actually these antibiotics, they actually have access to them. Because currently there's still hundreds of thousands of children dying of diseases like pneumonia that could be treated with very cheap antibiotics. So we do have to work on ensuring access, but also try to better use the antibiotics we currently have and that we hopefully will develop.
I have about 30 seconds. If you could tell us about the discussions that are expected to happen here at the World Health Assembly on AMR.
Well, tonight we are launching actually a new project together with a not-for-profit organization called Drugs for Neglected Disease Initiative, and that is a product development partnership that is hopefully going to make a contribution to fill the research and development pipeline for new antibiotics.
Well, thank you very much, and congratulations on your work, and good luck for this very important work. So there you have it, a very important and serious public health threat which is getting a lot of urgent attention here at the World Health Assembly. The WHO Director General, Dr. Margaret Chan, described antimicrobial resistance as a slow-motion disaster which will reach a tipping point where it will be difficult to reverse the harm done. And let's hope it doesn't come to that, and we can preserve the efficacy of antibiotics for our future generations. We're going to have to stop now. We're out of time. But tomorrow, we're going to talk about Sustainable Development Goals, the world's new to-do list for a fairer and healthier world. So don't forget to join us from the whole team here. Bye-bye.